What are the 4 biggest challenges for virtual care? In the last lecture, I discussed the quadruple aim of healthcare in general and how virtual care is fantastic. If you haven't checked out the video, please look at the playlist. Today, we're going to discuss what are the 4 biggest challenges that is hurting virtual care for even mass adoption after the pandemic. The first one is the regulatory challenges. What we have is that we have multi-state licensing and we have a fragmented system. I really hope, like the VA system, we should be able to provide virtual care in any state with one license, and that's quite possible. The second other thing is credentialing. It is annoying to even see health systems requiring repetition, redundancy of paperwork for the different hospital in their own system. We need to have a better way to have credentialing completed and reduce a lot of redundancy that happens in the system. If you look at it, FSMB has published this. The link is at the bottom. There are only 12 states that have special purpose license for telemedicine. This should technically be either expanded to all the states, or all states should allow a parity between different states to use virtual care without a different license. The second biggest issue is interoperability. A true interoperability means that I'm able to extract patient data from different sources, different EMRs, etc. Unfortunately, we don't have that. ONC has been trying to get a hold of this, and this would be the really big impact on telehealth if true interoperability is available, because that will truly achieve the lower costs, because we can decrease the number of testing, we can decrease the number of transfers, and again, repeat and repetition of these things is not good for cost or the patient. This is the ONC website. They came out with this new care plan for the whole nation, and they have a very good timeline. So hopefully by 2021, we're going to see a significant headway towards interoperability. Connectivity and computer literacy. Unfortunately, we still lack in both accounts. Infrastructure of within the hospitals, nursing homes, rehab institutes, Wi-Fi connection is choppy, and that unfortunately results in an experience of telehealth which is less than ideal. And on the other side, broadband access within homes via wireless or cell phone services is also lacking. 5G cannot come sooner. So we definitely need to work on that as far as to have better broadband access in public and better Wi-Fi access in institutions. Also work on designs that are actually friendlier for our elderly patients. A user-friendly design works very well, and we have seen that kids as young as 2 years old and elderly people as older as 90 plus years are able to use iPhone because of their user-friendly design. This is a very good article if you want to review that basically argues that broadband access is a public health issue, and according to law should be available everywhere. And user experience is not only important for patients, it's also very important for providers. We need to decrease the amount of clicks we have to do so that we can get on with patient care rather than charting. And as you can see, with great design, patients with an age of 100 has been provided care over telehealth and enjoyed it. So this is from University of Kansas that actually published this on their website, cited below. The other thing, the biggest issue that I personally feel with the mass adoption is pay parity. Currently that I know of, and things are changing so much with the pandemic, there's only one state, which is California, that has true pay parity. What it means is that if I'm providing care in person or via tele, I am reimbursed at the same rate. People have argued multiple things about it, but at the end of the day, as a physician, I'm never going to choose telehealth if it is not appropriate for the patient. And that is something you have to keep in mind. What telehealth gives me is another option to make sure that I provide the care in a timely fashion, in a most appropriate fashion. And if the person needs to come in, I'm going to call in the patient, period. It still happens. People call me in my clinic, the nurse gets a hold of it, calls me right away, hey, this is serious, or I get a call by myself and I tell them, come to the ER right away. It is not that telehealth is going to change that equation. What is going to change is that if I can beam in and make sure that this patient really needs to come into the ER will decrease the admissions and change the cost equation completely. So we need universal pay parity. We need to decrease the variability between states. We need to make sure that originating sites is basically everywhere. And then there will be also, from a private payer perspective, a standardization of payment systems, especially for tele. It is extremely important. So those were the 4 challenges. VeeMed also provides a great solutions for inpatient care, including vCart, vCart Lite, vVow, and vCast. vVow is basically workstation on wheels. You can convert any workstation that you currently have into a telehealth portal, and similarly vCast is you can convert any TV into a telehealth portal. Please check us out, and thank you. This is a place you can connect with us online. Thank you very much.